immune system was actually introduced 33 years ago by its founder, Dr. Zhou Feichen, a scientist immunologist. And the concept of nutritional immunology is that a healthy immune system can help the body stay healthy and even prevent the occurrence of diseases. Because our immune system is our built-in resistance, it is actually our internal doctor, the best doctor ever that has been gifted us when we were born. And even with these developments in modern science, they have not yet found something that can replace this amazing immune system. To look back to what we have been talking about during the past 2 days, in this figure, you can see that our immune system is distributed all over our body, from the head down to the soles of our feet. And as you can see here in this picture, it has always been mentioned during the past 2 days that the adenoids, the tonsils, the right lymphatic duct, the subclavian veins, the thymus, the spleen, the Peyer's patches, the appendix, the red marrow producing bone, the lymphatic vessel, and the lymph node compose our immune system. And to review, our major immune organs are our bone marrow, where our red blood cells, white blood cells, and granulocytes are being produced, as well as our thymus gland, where the cells that are produced in the bone marrow, particularly the white blood cells, gets to be trained in the thymus gland so that they will become specialized cells, namely memory T cells, helper T cells, cytotoxic T cells, natural killer T cells, and suppressor T cells. And in a harmonious way, these different kinds of specialized cells work together to protect us from getting sick due to virus, bacteria, and even cancer. And we also have our peripheral immune organs that help in preventing the occurrence of these different kinds of illnesses, all distributed all throughout our body. What are the factors then that are needed for a healthy immune system so that this growing baby or us who would like to be healthy can look into so that our immune system will be healthy? There are 4 factors that has been introduced since 1987 by this nutritional immunology scientist. One is exercise. Why is exercise so necessary? It doesn't have to be strenuous exercise. Moderate exercise can be brisk walking or anything that can enhance the contraction of the muscles, because with exercise, lymph circulation is enhanced, and this helps eliminate metabolic and other products from the body. The second factor necessary for our immune health is emotional stability. Emotional stability prevents the release of corticosteroid. This corticosteroids, when we are stressed, is released. And when it is present, it weakens the immune system. It has been said that 30 seconds, when one is angry, in 30 seconds, there will be release of corticosteroids. The third factor necessary for the immune system is adequate rest and sleep. Because it is during this time that our immune system is enabled to repair our DNA. Remember, it is the DNA that has to be healthy, so that in total, we will be healthy. And the fourth factor is proper nutrition. Proper nutrition can enhance the health of our immune system. But what is actually proper nutrition for the immune system? Is it the food that we are taking now at the moment or at the present time? Because food has been revolutionized in these modern times. So let us look at what this proper nutrition is. Well, to look into the recommendation about a step forward for your health, the Center for Disease Control and Prevention has released, as a result of their research, that a growing body of research shows that fruits and vegetables are critical to promoting good health. To get the amount that's recommended, most people need to increase the amount of fruits and vegetables they currently eat every day. And to date, WHO has recommended 10 types of fruits and vegetables in different colors and parts. But what is the recommendation of nutritional immunology? We will see in a while the recommendation of nutritional immunology. If we look at the old and the new food pyramid, you will see here that it has also changed. On your left side is the old food pyramid. On your right side is the new food pyramid. And if you have to look at it, in the lower half or even more than half of this food pyramid, where the base is wide, you will see vegetables, fruits, whole grains, plant oils, nuts, seeds, and legumes. And on the top part, written on with red ink, it says there that we have to limit the intake of red meat and butter and limit high glycemic foods, because these are not the food that our immune system will need. Okay, so what are the recommendations of nutritional immunology scientists as a criteria for proper nutrition? We have mentioned in the last 2 days that it must be plant source because it contains the nutrients, micronutrients that we need for a healthy immune system. And not only that it should be sourced from plants, it must also be natural and healthy. It must be wholesome and not isolated vitamins. It must contain phytochemicals, polysaccharides, and antioxidants. And as I have said, WHO recommends 10. Nutritional immunology scientists recommends a variety of 15 kinds of fruits and vegetables in various colors and parts. And foremost is it must not be damaging to the DNA. Remember, in the early part of this lecture, I have mentioned to you that the DNA is the basis for the basic element for a human being. So if the DNA is damaged, even if it's only one, and if it's replicated, then there will be something. There's something wrong that's going to happen. And for this immunologist, nutritional immunology scientists, to be able to determine if these foods are damaging or not to the DNA, they subjected these fruits and vegetables to Comet assay. And as we have mentioned in the past days, if these fruits and vegetables will lead to the development of a tail resulting to a comet, then it means to say that this food is not safe for consumption. The longer the tail, the more damaging it is to the body. Okay, let us look at the nutrient focus of nutritional immunology. These varieties of fruits and vegetables must contain phytochemicals because these phytochemicals nourish the immune system. Furthermore, they speed up recovery from illness, and these are sourced from fruits, vegetables, beans, grains, cactus, and soy. Different kinds of fruits and vegetables have different amounts of and kinds of phytochemicals. Pineapple, for instance, has 26 types of phytochemicals. Orange has 176, but the best, according to the research of nutritional immunology, the greatest number of phytochemicals come from cactus berries because it has more than 10,000 phytochemicals. Well, if you have to imagine, cactus grows in the desert. And why do they survive? Because they have their own protection of this vast amount of phytochemicals. These are the vegetables and fruits that can give us sufficient amount of phytochemicals if we have to consume them every day. The soybean, the psyllium husk, banana, broccoli, spinach, snow pea, leaf lettuce, radish leaf, asparagus, kale, green bell pepper, mustard greens, and romaine lettuce. And the benefits that you can get from these fruits and vegetables if you are consuming them on a daily basis, which is also good for our pregnant women, taking care of the baby inside the womb. These are the benefits. They are rich in protein, calcium, iron, folic acid, fiber, antioxidants, and phytochemicals, which are necessary for the growth of the baby inside the mother's womb. So this is actually good for pregnant women and for fetal health. It is also necessary for the growth and development of children. Eating this gives us balanced nutrition and makes our bones and teeth strong. It also can prevent calcium deficiency and anemia. Calcium and iron are very necessary for fetal growth and development. And these fruits and vegetables are very good source. They are also good source of fiber, and they are ideal for weight management. So this can be given to pregnant women. You know, during the 20th week of gestation, mothers are prone to develop diabetes because there's something that's happening, that's what we call glucose siphoning by the baby. So the tendency of the mother is to take in lots of carbohydrates or food high in sugar. But if these mothers can get hold of these fruits and vegetables during the time that they are needing more calories, then this is ideal for their weight management, and it can also prevent the occurrence of gestational diabetes. Okay, one important source of phytochemical is soy, or what they call the yellow jewel. Soy is a good source of protein, and it is cholesterol-free. It contains nutrients essential for health, protein, as well as the essential amino acids needed for the growth of the developing baby, carbohydrates, and vitamins. It is also high in fiber, low in saturated fat, rich in calcium, iron, and phosphorus, which are very necessary for the growth of the baby. And it provides all the essential amino acids needed for human health, whether this is a fetus or a human being, irrespective of age, children, adults, pregnant women, or even the elderly. The other nutrient focus of nutritional immunology are polysaccharides. Polysaccharides are long chains of sugar that help balance the immune system. Actually, it enables the immune system to destroy viruses. And to date, it has been used as a source of sources of those that they use as antiviral. Our pregnant women are considered vulnerable group of the population, and intake of this can increase the total number of immune cells in the body. And during this time of pandemic, it can be protective to these pregnant women. The sources of polysaccharides are agaricus mushroom, yunshi, shiitake, maitake, and reishi mushroom. You see them in the supermarket and in the market. One of the most important source of polysaccharide is the ABM mushroom, or what we call the agaricus blasemureal mushroom. What does it do? It enhances the absorption of calcium in the body, and it has ergosterol that converts it to vitamin D. Ergosterol together with vitamin D2 combine to protect and strengthen bone health. So this is very important during fetal development. It has been found that ABM mushroom has the highest percentage of iron among plants. It has 9.65 milligram iron per 100 gram of ABM mushroom. It is easily absorbed. This is the good thing. And it has no side effects. Besides, it is high in protein, vitamin B1, B2, calcium, potassium, sodium, phosphorus, and iron necessary for our immune health. The third nutrient focus of nutritional immunology are the antioxidants. Antioxidants, which are sourced from rose hips, cactus fruit, berries, and grape seeds, all types of berries, can boost immunity by ensuring the normal function of the immune system, regulating it and balancing it. And one added factor is this antioxidant can delay aging. So if you're consuming more of these berries and rose hips and cactus grape seed, then you will look longer for a longer. You will look younger for a longer time. Okay, one of the greatest source of antioxidants are rose hips. It has ascorbic acid. Actually, it is 50 times vitamin C as compared to the others. It has niacin and other vitamins. One good thing is it can enhance production of collagen, improve skin texture and appearance, and maintain skin firmness and elasticity. So you look younger. It can protect us from the harmful UV rays as well as those radiation that comes from our gadgets, which we use every day. And the other function is it improves blood circulation. So, okay, as a medical practitioner, why did I introduce this to my patients? Actually, I was introduced to the science of nutritional immunology way back in 1997. When I think it was a year or 2 years that it was introduced here in the Philippines and by Dr. Chen. Because of a health need, I got to study more about this nutritional immunology. And this is the personal conviction that I have. I need to stay healthy, youthful, and I want to stay, I want to spend my retirement years enjoying it, not getting sick. So I started taking the products research by nutritional immunology way back then, because I was so allergic to so many medicines. That is why I had to shift to this healthy, wholesome food for me to stay healthy. Then as a medical professional, nowadays, there are so many things that have changed. Even those that were taught us during our medical studies have already changed, and they are not true anymore during this time. And I consider this nutritional immunology as a new advancement in science, which is part of my continuing medical education. We as doctors undergo continuous education. We call this continuing medical education because of new developments in science. And I think this should be the outlook of our doctors nowadays, especially now that we have so many resistant strains of bacteria and we have viral mutations. We cannot give patients exact treatment for all these changes in our environment. So can we just stop and not look for other remedies for us to stay healthy? I think this nutritional immunology science must be given attention to nowadays. You see, if we have patients who have received vaccines and yet despite the full dose of the vaccine, they still get sick. So what should we do? I think enhancing our immune system is a necessary part for us to be able to prevent getting sick, whether we are pregnant or not, so that we can put we can help flatten the curve. Let's stay healthy by eating this healthy, wholesome food. One of the visions of, or actually a vision of the founder of nutritional immunology is a healthy generation. So if we are feeding our children, if pregnant women, if they are taking healthy, wholesome food and will feed their children healthy, wholesome food, likewise, then having a healthy generation, not only the next, but the future generations is a big possibility. And because of these good effects on the health, for me, as well as my family and my patients, that is why we are embarking on this nutritional immunology awareness for everybody all over the world, so that we can all stay healthy. Because I think for us to stay healthy, it is better to have to focus on prevention rather than cure. If we have ourselves protected and prevent getting diseases, then cure is not a problem for all of us. Okay, we consider this nutritional immunology wholesome food as the latest trend in nutrition. You see, it says here, your child is what you eat. If a mother is healthy, naturally the baby would be healthy. Give a fetus essential nutrition and create a lifetime of health for your child. For a healthy citizenry is a healthy country. Okay, regarding nutritional immunology and longevity, building a healthy body when one is young sets a good foundation later in life. A malnourished fetus will be more at risk for diabetes. Overweight or obese when young raises the risk of chronic illnesses like cancer in adult life. And as long as the body is nourished properly and taken care of, it can live to at least 120 years healthy and happy. So if you can see here, these two children here, two girls are my daughters. No, I have taken this healthy, wholesome food during conception, and they were, I think, 7 years old and 4 years old at this time. Dr. Chen said, to borrow her words, add years to your life and life to your years. Okay, so thank you very much. These are my kids now. Maybe this other girl is taller than me now. Okay, so thank you very much. I hope I have given you a good knowledge about nutritional immunology that can help you, your family, and your friends healthy.
Thank you so much, Dr. Jara, for that very informative lecture on nutritional immunology from wound to longevity. So we see, guys, the importance of nutrition while while the mother's pregnant. Okay, and so if you have questions, guys, you can put in your question in the chat box. Okay. All right. Actually, we have questions here, Dr. Jara. Okay, one question here is, doctor recommends eating folic acid for pregnant women. What is the difference between folic acid and foliate?
Oh, yes. During the early part of pregnancy, we actually give this folic acid, especially during the first 12 weeks of pregnancy, to prevent the occurrence of brain problem or this spinal cord problem. But the difference, why is it better to give folate rather than folic acid? Folic acid is a synthesized version of folic acid, of folate. And if there is, the requirement actually is 400 micrograms. But if we give an excess of it, and these are unmetabolized, there will be health problems that will happen as a consequence of the too much taking of folic acid. Folate, on the other hand, is in wholesome food, such as leafy vegetables, citrus fruits, the one that I flashed earlier, the different kinds of fruits and vegetables, they are very high in folate. And as we have said in our early talks, if you compare an isolated nutrient that you take from the wholesome nutrient, if you take excess of it, then it can harm the body because of the possibility of high side effects. But if you source your folate from wholesome food, even if you take in lots of it, there will be no harm because the folate is will just be as part of your fiber.
Okay. All right. Thank you so.
Yes.
Yeah. Thank you so much, Dr. Ano. Another question here is, as a medical doctor, what can you say about cow's milk that's been given to babies?
If you look at, by the way, nowadays, breastfeeding is the trend. WHO recommends DOH recommends. In our hospitals, we don't have bottles anymore because it has been found out that breast milk is still best for babies. And if here in the Philippines, if you go to hospitals, we already recommend breast milk because it has all the nutrients that is necessary for fetal growth. If you look at cow's milk now, we collect our milk from cows, right? But our cows now are given hormones to grow up fast so that they can be milked. The reason why we are recommending this breast milk is because they provide the nutrients that are necessary for the baby to grow healthy. And they have the antibodies that are developed within the mother. If the mother gets sick, she develops antibodies. Remember, there is this memory cells that will remember that you have this infection, and then the next time that you are exposed to the illness, you develop the antibodies. The antibodies that the mother has will be passed on to the baby. And the protection that the breast milk can give to the baby can last after 2 years after the baby is born. In the 1,000, it will be protected during the first 1,000 days of life from the womb to when the baby is 2 years old. That is why you always hear that you give breast milk up to 2 years old. The essence of that is the nutrients that the mother has, the antibodies, and the protection that the mother has can be passed on to the baby after 2 years of age. And I'm happy to tell you that my babies whose mothers took wholesome, healthy food don't get sick during the first 2 years of life. Sometimes all the members of the family are sick with flu, but the baby is not. The baby doesn't get sick. If the baby gets sick for 1 or 2 days, the baby will get well even without medication.
Yeah, which goes to my second question, Dr. Hara. What are the benefits of a mother eating nutritional immunology foods while they're pregnant? What are the noticeable effects on the babies when they come out?
Let me tell you one story that I had to concretize what good effects these wholesome plant foods have. I have a patient who is 40 years old. She had 3 miscarriages. And after the 3rd miscarriage, I actually did a D&C for the 3rd miscarriage and examined her. I noted that she had severe adenomyosis. The uterus is not healthy. She had endometriosis, so the ovaries are also not healthy. So what we did was, after the D&C, I treated her medically. And then during that medical treatment, she went abroad. She got pregnant there. And on the 4th pregnancy, during her 8th week of pregnancy, she was bleeding. She thought that this baby is again lost. It's again an abortion. So she came to the Philippines and during, I did an ultrasound. Being an ultrasound specialist, I did an ultrasound and the baby was alive. So I had to, the uterus is still, the uterus still has adenomyosis. There's still problem. I confined this patient. I had a clinic at the time. I confined this patient, let her stay in bed, and then I started giving this healthy, wholesome food. Actually, she was the first patient to whom I gave this healthy, wholesome food. And together with healthy, wholesome food, we gave her natural food. You know how difficult it was? The mother cannot even talk because every time she talks, she bleeds.
Wow.
Yeah. She was confined to bed. My attendants had to care for her. She bathed in bed. She had a Foley catheter because every time she moves, she bleeds. And all throughout that 8 months of pregnancy, we fed her with natural, wholesome food. The baby was born at 32 weeks, cesarean section. And this girl is very smart. She's musically inclined. She's into sports. She's very brilliant. And Well, I said I was introduced to nutritional immunology in 1997. This girl is now into medical school.
Wow, that's
That's,
nice.
yeah, that's the
That is
first.
so great.
Yeah, that's the first patient that I gave healthy, wholesome food.
Wow, it's nice.
Yes. Another story is I have a patient who has not been pregnant for 7 years. She's quite obese, and the father has also the partner has also a problem. They came over to the Philippines 3 years ago, and well, after examining them, I advised them to, because they had been into lots of workup already, and I said I cannot offer you anything more, but to take care of your nutrition. So again, I started giving this healthy, wholesome food. When they left the Philippines, they're actually based in New Zealand. When they in Ireland, when they left the Philippines, they brought with them food enough for 6 weeks, 6 months. On the 3rd month, the mother got pregnant, and they were so happy. Now the baby is 2 years old.
Wow.
Yes, after 7 years. After 7
Wow.
years, I gave nothing more except that I just told them to eat healthy.
Okay. Wow, wonderful stories, Dr.
Yeah.
Hara. Okay, there's another question here from Dr. Jean Villanueva. She asked, what is the best way to lower down cholesterol?
The best way to lower down cholesterol is to eat lots of fruits and vegetables because they don't have cholesterol. As I have said, phytochemicals, which you can find in the different kinds of fruits and vegetables, particularly the leafy ones, and soya, has lots of fiber in it, and they are non-cholesterol. No, they don't have cholesterol. So consuming them on a regular basis will actually lower your current cholesterol level. I remember we had this, what do you call this? Weight challenge before, remember? Weight challenge for 6 weeks. This advocates took these different kinds of fruits and vegetables on a daily basis for 6 weeks. And there was a good result in terms of the lowering of their cholesterol, improvement of hypertension, and weight reduction. And the beauty of this, remember, we were amazed because when they showed us pictures, we cannot recognize them already.
Oh,
Oh, they look younger and they look better.
all right. It's good, Dr. Hara. That's another question here. Can nutritional immunology plant foods help lessen inflammation? Now, she said, I'm in a dental practice and fast healing of the gums. Is there, yeah.
In terms of inflammation, Doctora, the reaction of the healing process when we eat these wholesome fruits and vegetables will be inflammation initially because it's the white blood cells that will be working. There will be initial reaction of inflammation, more than what we expect if we don't get to eat these fruits and vegetables. But after some time, after the inflammation has subsided, you will see that the healing is faster.
Oh, okay.
The healing is faster. Yes.
All right. So based in your experience, Doctora, if we give plant foods, nutritional immunology plant foods to children, how does it affect their bone health and teeth?
I have mentioned earlier a while ago about this high source of calcium, like soya. The soya has iron and calcium in it that is necessary for bone health and the health of the teeth. So it is enhanced. The health of the bones and the teeth of children fed with this nutritional immunology wholesome food, or fruits and vegetables for that matter, that has high contents of these phytochemicals, polysaccharides, and antioxidants, can have better health in terms of their bones and teeth.
Okay, thank you so much. Another one here from Dr. Kalayan.
Yes.
She's asking, what is the best nutritional immunology product to be given to a gestational diabetic pregnant, since we have different kinds in the list?
If we have to feed these patients, considering that we should be giving them low glycemic index food, then I think the combination of these different kinds that I have shown earlier, like the different kinds, the 12 kinds of fruits and vegetables, kale, lettuce, with the soya, and all those. If you give them on a regular basis together with soya, then because they have low glycemic index, then the fear of having this mother develop gestational diabetes is diminished, or it might not even occur, because we are giving low glycemic index fruits and vegetables to our patients, and yet they are receiving enough nutrients that is necessary for the development of the fetus inside. During as I have mentioned, during the 20th week of pregnancy, we have what we call glucose siphoning. And this is during the time that we fear that these mothers, if they don't eat the right kind of food during this time, there's a tendency for them to develop gestational diabetes. So giving them food with low glycemic index, low cholesterol, sufficient enough to nourish the baby, will prevent the occurrence of gestational diabetes. But of course, they also have to follow the 4 factors for a healthy immune system. I have a patient, a doctor actually. She's not a patient. She's a friend of mine. She's not my patient. She's a doctor friend of mine who called me up because she cannot control her blood sugar anymore because of the very high requirement for insulin. And she said, I don't know where to go. What can I do? And I said, what if we just alter your diet? Is it okay to alter your diet? So we give her a combination of phytochemicals and antioxidant, taken twice a day. With these products of nutritional immunology. And after 3 days, she called me up. She said, no, I'm so happy. I have reduced my insulin requirement to 50%.
Wow.
And also, after 4 weeks, she said, I lost weight.
Oh,
And I'm enjoying the food that I am eating.
that is good, Doctor.
Yes.
Okay, another question here from Lewilinte. She's asking, does this wholesome foods prevents the onset of postpartum disorder among mothers who gets it after giving birth? And why do they get PPD, and what is the cause?
Postpartum disorder, do you mean postpartum blues?
Yes, yeah.
Postpartum blues, there are many factors that can give rise to postpartum blues. But if these mothers are nourished, you diminish their problems of getting other illnesses, then probably this can help. This can help a lot. But in terms of postpartum blues, there are many factors that can trigger it. So you have to discover all the others. But giving them proper nutrition will diminish their health problems. So in a way, it can help in preventing postpartum.
Right. Okay, another one that's sent to me via text. He was asking, does pregnant women lose a lot of collagen after delivering baby?
Bakit kaya tinanong yon?
Hindi ko po alam.
What happens during pregnancy when we talk of collagen is the skin gets stretched.
Okay.
And they develop stretch marks.
Mm-hmm.
If these patients are not eating the right kind of food, that will improve the production of collagen within the body, because we produce our own collagen. The better one that will result to the development or production of collagen is through the food that we eat. So
Mm.
if we are eating these fruits and vegetables, especially the antioxidants, that can enhance the development of collagen, then we will minimize the development of stretch marks.
Oh, okay. That's
Yes.
good.
And actually, it has really very good effect, no, on pregnant patients, because of the stretching that the baby because
Yeah.
of the bigger baby, the bigger the baby, usually it's stretched. Although it's not always the case. Now, if the baby is big, you will develop stretch marks. No, it also depends on the nutrition that you are taking.
Wow. So
So
if they are, yeah.
in terms of loss of collagen, if they take in these fruits and vegetables that are considered antioxidants and important in the synthesis of collagen within the body, I don't think it will be a problem.
I see. Okay. Yeah. So that is good enough. If they are pregnant women out there, okay, who want to avoid the stretch marks, maybe they just have to take a nutritional immunology plant foods, that is very rich in helping the body produce collagen. So in preparation na po yan.
Actually, Jerwell, why are we recommending this nutritional immunology products to our patients, to our friends, and to the members of our family? It's easy. You can just go to the market and buy them. But in this past phase of life, in this era where there are so many insecticides and pesticides, we have genetically modified fruits and vegetables already. So
Yes.
what health do we have? Why is it that we have so many cancer patients? Why is it that there are so many people undergoing dialysis? Very young patients having stroke because of the health, the kind of food that we are eating. And these nutritional immunology products, which we are so passionate about in introducing to our friends, to our patients, is the convenience and the safety of these products.
Okay. All right. So, wow, we only have 1 minute left. Last question from Canada. Are these plant foods researched by Nutritional Immunology available in the market? Since I find it very safe to eat, I'm interested to give it to my patients.
Can you repeat the question?
Are these plant foods researched by Nutritional Immunology? Is it available in the market? Since I find it very safe to eat, I'm interested to give it to my patients.
Oh, thank you for that question. Actually, these fruits and vegetables are available, but it depends on the area where you are based. You cannot access them in the market or the supermarket all in all at one time. But these nutritional immunology scientists have researched these products. They have an area where they planted it. They collected them at the right time with the most nutrients that it can give us. And they process this so that it can retain its freshness and the amount of nutrition the maximum amount of nutrition that it can give us. So they have these products they have these products available for convenience. But if you can access these fruits and vegetables in the market and in the supermarket, there's no problem about it, for as long as you know that these products are safe for consumption because of the current trend of agriculture nowadays, no? But these research products are available. And maybe you're the one who can answer it, Sir Jerwell.
Yeah. So for those who would like to ask, who was asking that, you can ask the person who invited you po, no? Yan. Last question, Doctora, no? So since it's already 8 o'clock, Mary Arlene Ponce is asking, what is the reason of having low amniotic fluid even at the 3rd trimester?
Low amniotic fluid will depend. Actually, it's the baby urinating. That's why you have much of this amniotic fluid.
Oh.
If the amniotic fluid is low already, there's something wrong, probably in the baby. But the mother is dehydrated. So there's low amniotic fluid. And the problem with low amniotic fluid, if there's no fluid inside, the baby gets compressed, and the umbilical cord that supports the food to the baby might get pressed, and the mother might receive the baby might receive a minimum amount of nutrients during that time and this is very dangerous also for babies, because if it gets pressed, if the umbilical cord gets pressed because of the decreased amount of amniotic fluid, then there might be a problem that will happen to the baby.
I see. All right. So, wow, still a lot of questions, but we have no more time. Dr. Hara, thank you for answering all these questions. So thank you so much for the questions you've posted here sa ating chat box. So guys, this ends our third night of our online class of nutritional immunology. So we'd like to thank Dr. Margarita Hara for that very wonderful presentation. Yan. Okay. So tomorrow we'll see you again for our exciting discussion again on the science of nutritional immunology. We'd like to invite again everybody, and you can still invite guys, sa mga friends po ninyo and mga loved ones po natin, we can still invite them on our training or our seminar tomorrow night. Okay, so thank you so much, Dr. Hara, and to our friends, fellow advocates from Malaysia, USA, Canada, and Europe. Thank you so much for attending. Okay, so thank you for supporting always our seminar here. Okay, so thank you so much. Any messages, Mr. Lee, if you're here, regarding tomorrow's event?
Jerly is not around. I think tomorrow it will be nutritional immunology and cancer.
All right, that's good. Gandang topic po. It's a very nice topic, So nutritional immunology and cancer. So please invite your loved ones and friends to attend our discussion for tomorrow. So thank you guys and have a good evening po sa kanilang lahat.
Yes, I can.